Condition Presentation, Cognitive Dementia by Linda Cathay, Student B. The Psychiatric Association, or the APA, released the 5th edition of its Diagnostic and Statistical Manual of Mental Disorders, the DSM-5. The term for dementia was replaced by the updated manual with major neurocognitive disorder and mild neurocognitive disorder. Now that the DSM-5's terms differ, they should have little effect on the person-centered, abilities-based approach to care that we promote. Dementia is related to the Latin word for mad or insane. By definition, it is a condition involving impairments in thinking, remembering, and reasoning, which affect a person's function and safety. The introduction of the term neurocognitive disorder helps reduce the stigma associated with both the word dementia and conditions that it refers to. The APA acknowledges that because the word dementia is in common use and easily understood by everyone, it will likely remain in use. The terms neurocognitive disorder and minor neurocognitive disorder are likely to be used only by some healthcare professionals and organizations. Dementia care specialists use the term dementia because it refers to a variety of conditions that can be caused by a number of factors. Dementia is an overall term that describes a wide range of symptoms associated with a decline in memory or other thinking skills severe enough to reduce a person's ability to perform everyday activities. Alzheimer's disease accounts for 60 to 80% of cases. Vascular dementia is the second most common type. Dementia is incorrectly referred to as senility or senile dementia, which reflects the formerly widespread but incorrect belief that serious mental decline is a normal part of aging. Dementia causes can be reversible, or they can be irreversible and progressive. There are many factors that can cause symptoms of dementia. Potentially reversible dementia symptoms include those caused by depression, stroke, traumatic brain injury, certain medications, and even bladder infections. Irreversible and progressive dementias include Alzheimer's disease, vascular dementia, Lewy body dementia, and frontotemporal dementia. The DSM-5 focus on a decline rather than deficit in function. Dementia care specialists train therapists and other healthcare professionals to focus not on the disabilities of people, but on the abilities of people with dementia. They help care specialists create the just right level of challenge so a person with dementia can stay engaged, remain productive, and retain feelings of self-worth. It's essential that the family and the other caregivers of a person with dementia recognize the changes in the person's behavior and function. This helps them to simplify and adapt activities to help the person retain function, mobility, and quality of life. It's vital to recognize that each person with dementia has many remaining abilities. The most advanced stage of dementia a person has is the ability to have meaningful relationships and emotional experiences. The APA's diagnostic criteria for major neurocognitive disorder and minor neurocognitive disorder focus less on memory impairment than the former DSM-4 criteria for dementia did. The de-emphasis on memory impairment allows for variables associated with conditions like frontotemporal dementia or FTD, which sometimes begins with declines in speech and language usage ability, and do not necessarily affect memory immediately. It is essential to recognize, diagnose, and treat all forms of dementia and all its symptoms with the goal of helping people to function as safely, as independently, and for as long as possible. The DSM-4 also states that individuals with major neurocognitive disorder exhibit cognitive deficits that interfere with independence, while persons with mild neurocognitive disorder may retain the ability to be independent. The DSM-4 also states that individuals with major neurocognitive disorder exhibit cognitive deficits that interfere with independence, while persons with mild neurocognitive disorder may retain the ability to be independent. Experienced healthcare professionals using the cognitive disabilities model and the Allen battery of cognitive assessment tools can identify and recognize the effect of a cognitive or memory impairment on a person's daily abilities and function, and can facilitate remaining abilities and provide care, environmental supports, and assistance where needed. A consideration about the addition of criteria for mild neurocognitive disorder is that this new term is intended to promote early detection and treatment of cognitive decline. Early detection is essential, as doctors, therapists, nurses, and other care professionals must be there with skills to guide and support individuals and their families both early on and throughout the disease process. This can help slow progression, ease suffering, and improve the quality of life for both the person with the disease and their loved ones. The International Classification of Diseases version 9, or ICD-9, outlines codes that describe conditions and complexities in order to support skilled intervention. These include dementia, Alzheimer's, mild cognitive impairment, memory loss not specified elsewhere. Additionally, as a therapist, they always make sure to use the code provided by the person's doctor.